Today on the steps of Parliament, nurses and midwives from right around the state rallied on the steps of our Parliament House. They came from Mount Barker, from Flinders, from the Lyle Mac, from Hampstead, from Noarlunga, from Modbury, from the QEH and Glenside in buses. They walked down from the Women's and Children's and the RA, and in fact many made their own way from various other workplaces. Some of the placards included "Tiny patients, big responsibilities, fix our ratios now." One of the chants was "Count the babies." As we know, babies are not currently counted in the government's proposed nurse-to-patient ratios. They quite rightfully outlined that we had relied on their workforce during COVID, where nurses working in our emergency departments slept in tents in their backyards so that their family would not potentially come into contact with COVID, that they are amongst the lowest paid in the country in the public system. And even with the 13% over 14 years offered this week, that would actually only bring them to the second lowest paid in the country as a workforce. They also outlined that they face physical and verbal abuse and violence in their workplaces. They called for respect. My question to the Minister is, when will the Malinauskas government give the nurses and midwives of this state in our public sector respect and meet their demands?
I thank the honourable member for her question and her advocacy for some of the hardest working, most respected parts of our public sector. The thousands of nurses and midwives right across South Australia do a remarkable job, as the honourable member has outlined, of keeping us safe in times when it's needed, such as the COVID pandemic, but also every single day from public sector nurses in hospitals, this from Mount Gambier to Cooper Pedy to Ceduna and all points in between. There wouldn't be a South Australian that isn't able to recall a time when a nurse has shown that extraordinary kindness and dedication to themselves or a family member, sometimes at the most difficult times of their lives when they or loved ones are very sick in the public sector health system. We continue to negotiate in very good faith with the nurses. The honourable member outlined the current headline wage offer, which stands at, I think, 13% over 4 years. Just yesterday, there were further increases to that wage offer that were formally put to the ANMF, the Nurses and Midwives Union, that included bonus payments in between each yearly pay point, an additional payment for regional incentives, so that in addition to the starting at $1,000 but going up from that, as I understand it, at various regional locations for the first 5 years, a further payment for completion of 5 years in a regional area, I think of $3,000 of another amount, and then for every 3 years after that, further payments for regional incentives for nurses. We will, of course, continue to have discussions with the Midwife and Nurses Federation in South Australia. I know myself, the Health Minister, occasionally the Premier actively involved in those and other public sector discussions, and will continue to do so.